Peptides are being commonly used right now for weight loss. If you've heard of somebody being on Ozempic or Wegovy or any of the other weight loss injectables, those are all peptides. GLP-1 is the technical name for it, and that stands for glucagon-like peptide. So it is actually just a peptide. They work on your metabolism. They work on the satiety centers in the brain. They work in your stomach with the stretch receptors. It is commercialized. It's made in commercial pharmacies. And yes, they work really well for weight loss. Some of the most popular peptides for performance and endurance are going to be in a category of what we call secretagogues. And this means that they are going to work in the pituitary gland where a lot of our master hormones are made. They're going to stimulate the pituitary gland to go ahead and release things like human growth hormone. Human growth hormone is a growth hormone. So it causes the body to make more muscles. It makes the muscles stronger, but it also decreases body fat. So a lot of men will come to me wanting to put on more muscle mass, and it would be very popular for them to use a secretagogue in addition to their testosterone therapy. Some of the peptides that might be in this category would be things like sermorelin, ipamorelin, and CJC. There's a lot of different ones in that category. That's just a couple as an example, but these are actually acting as signaling molecules to the pituitary gland to go ahead and make a hormone that it should be making already. So peptides are all the buzz right now. I'm getting a lot of questions from my patients about what are peptides? Are they candidates for them? Peptides are small chains of amino acids. So if you think about a protein, proteins are actually large chains of amino acids. And the actual definition is if there are more than 50 amino acids in that chain, it's a protein. If there are less than 50 amino acids, then it's a peptide. What you want to understand is peptides are signaling molecules in our body. They may be turning a protein on, they may be sitting in a receptor on a cell membrane. And so they're working with our body's own biology to do things naturally. These are processes that your body's going to do already, or maybe it's having issues doing them and you're just giving it a little bit of help. So if you're having issues with chronic pain, or maybe you're tired, fatigued, or you're not sleeping well, there's peptides for a lot of different purposes. And the biggest question you have to ask is, well, why are you taking the peptide? What are we trying to accomplish? Different peptides are going to do different things. There are peptides that help you sleep. There are peptides that help you make more muscle mass. There are peptides that help you lose weight. There are peptides that give you energy. There are peptides that help your brain function better. If you are a man and you're not getting enough muscle mass, you may want to be on a peptide that works along with your testosterone to help you gain some muscle mass. If you're finding that your cognition is getting maybe not as sharp as you used to be, you're going to want to do a brain peptide specifically. And right now, the peptides that most people are aware of are the GLP-1 medications, the Ozempic and Wegovy and things like that. Those are actually peptides. Many people are doing peptides and didn't even realize it. Peptides are becoming very popular right now for performance and in longevity because they do a really good job of working with the body. They're a little bit controversial. A lot of them were actually made in Russia. There's one particular Russian scientist who has the full support of the Russian government to try to make the Russian army better and stronger and more invincible. So a lot of the peptides that we get are coming actually from Russia. But the reason that they're becoming very popular is because they work. They fit into our natural chemistry. And so you're just enhancing what your body wants to do already. When I'm deciding which peptide a patient might be a candidate for, the first thing I ask is, what are you trying to accomplish? Most people don't actually realize that they do different things. So, I'm going to ask them some questions. Are you having difficulty sleeping? Are we worried about your weight? Are you trying to increase performance? Do you need brain function? What's going on with you? And then once we define what that is, then it's just a matter of picking from a list of peptides that do that specific function. So the biggest thing is just figuring out what the goal is. When someone comes to me and they have an injury, or maybe they have an intestinal issue, maybe they have leaky gut or even Crohn's disease, something like that, I'm going to recommend several peptides that work really well as healing peptides. I think the one that most people think of is BPC 157. That one heals pretty much anywhere in the body. It does help with endurance and recovery as well, but think of it more as a healing peptide. And TB 500, it turns on the thymus gland and it can help with your immune system as well. Brain health is something that peptides can really help with. There are two specifically, there's Cmax and Selank, that work in the brain, and they are actually what we call nootropics. They help you make new brain tissue. They can help create new neural connections. They can help with cognition and really help with memory. I have several patients taking them who've noticed a major difference with those brain peptides. Peptides are actually very safe because they are short amino acid chains. They are signaling molecules, so they're not going to do anything that the body wasn't going to do on its own anyway. Sourcing is really important. Because the FDA actually put a large mass of these peptides on a controlled substance list in 2024, they were still being made in sometimes very shady circumstances. The FDA has since lifted that restriction on those peptides. It actually, a lot of compounding pharmacies got together and the FDA caved, which is actually good news for us. But you want to make sure that where you're getting your peptides sourced from, that they have quality control, that they are doing regular quality testing, that they're not tainted with heavy metals and things like that. And all of the reputable places that you get peptides will give you their purity data, and they'll show you the last time that they tested and showed that that their product really is safe to use. One of the biggest reservations people have about taking peptides is a lot of them actually do need to be self-injected. They are subcutaneous injections, meaning that they don't have to be deep. They don't go into the muscle. You just need to pinch the skin anywhere. A lot of people, you're doing it on your abdomen. But if you're extremely needlephobic, not all peptides come in oral preparation. Some do, but the vast majority of them do need to be injected. Some are daily, some are weekly. But again, if you really hate needles, we might want to think of some other options. One of the questions I often get is, how long can someone take them? Do they need to take breaks from them? And it depends on which peptide it is. The weight loss peptides, GLP-1s, there's no reason to take a break with them. You're already taking them at 1 week intervals anyway. Definitely the ones that are working with human growth hormone, you're going to want to cycle on and cycle off. You may use them for 6 months and then take a month off. There's a popular peptide called epitalon, and it is commonly used to help with lengthening of telomeres. The most common dosing schedule on that is that you take it for 10 days straight every 6 months. So in that one, it's already built into the protocol that you cycle on and off. When using peptides, some of them you're going to see results very, very quickly. Think of the GLP-1 weight loss medications with Ozempic. Even from the very first shot, some people will start noticing that their cravings are gone and that they have appetite suppression. If you're looking at things like the secretagogues, it's not as direct. And so you're going to want to think more in terms of weeks, maybe months. One thing I wish people understood about peptides is that they're not just for bodybuilders or biohackers. They're really for the everyday person. Whether you're having issues with sleep, or maybe you want to lose weight, or you do want a little bit more endurance, there are peptides that will help you with everyday problems, and it's not just for the elite.